Thank you very much for coming, and welcome. I'm going to speak a little bit about the importance of having a yearly exam. As many of you perhaps have heard from the media or from your own physician, there are newer guidelines that say that healthy women may not need a pap smear every single year. People are like very excited. Woohoo, I don't have to come see you. I'm like, well, not so fast. And they're very excited. It's like, woohoo, you don't have to use this speculum thing. I'm like, not so fast. So if you come to see me, I have 10 reasons for you to come to see me every year. And
I can advance it for you.
oh, okay, awesome. Number 1, actually, I'm sorry, number 10 went the other way. And that's check your vital signs. When you come for your annual, your height is measured. I want to know if you're losing any bone, if you're getting shorter. Your weight is measured. Everybody dreads that. Shoes come off, jacket comes off, purse goes down. I have taken my watch off to be weighed before. Okay. But it actually is very important to track your weight, especially if you do not have a scale at home. 100 extra calories a day is about a pound a month. About a pound a month is about 10 pounds a year. Over 5 years, that's 50 pounds. So it really is important just to stay on top of things. With your height and weight, we calculate your BMI. Be happy to tell you what that is if you're interested. We check your blood pressure and we check your pulse. Blood pressure is one of those terrible things that often doesn't cause any symptoms when it's elevated. And so at a routine physical exam, that may be the first time that that we find that your blood pressure is high. And we ask you to continue to monitor it or to continue to come back into the office. Number 9. We review and update your personal health history and your family history. A new health history problem or a new health issue for you may change your medications. You may be taking a medication that is contraindicated. So for instance, if we do find that your blood pressure is high, we may need to stop your oral contraceptives. A new health problem for a close family member might change the recommendations that we give you for screening testing. So if your sister at age 35 develops breast cancer, that may change what I tell you to get, when I tell you to get your first mammogram, when I recommend. Number 8, we review your medications. We review the dose that you're taking. Is the dose that you're taking effective? If you're taking 50 milligrams of a medication, but you think, I could feel better, maybe we want to increase that to 100. Are you able to take all your medications? I have awesome medicines that work great that you have to take 4 times a day. I cannot take a medicine 4 times a day, so I certainly wouldn't ask you to. So we need to look for other things. If you're on a medicine that you're just simply unable to remember to take or use, please let me know so that we can look for alternatives. And the other important thing is just simply if your medications interact in any way. Sorry. Number 7, I'd like to take an opportunity to discuss recommended screening tests and immunizations with you at the time of your annual exam. If you have questions about the PAP schedule, concerns about the PAP schedule, they are guidelines. They aren't hard and fast rules, they're guidelines. And so we talk about the risks and the benefits of doing a PAP smear periodically versus every year. We talk about the risks and benefits of doing a mammogram every year versus periodically. There's some new guidelines that came out very recently that said maybe we don't need to do a yearly mammogram for ladies in their 40s. Most people have a lot of questions about that, and I'm happy to answer those questions. The reasoning behind that is very few women in their 40s get breast cancer, and lots of mammograms find something. They say, there's a little shadow here. Maybe you should come back. And you come back, and they're like, we don't know what this little shadow is. Maybe you should have a biopsy. And the point of that is, for many women, this is hugely anxiety-provoking, and it turns out to be nothing. So that's something to consider when you choose how often you'd like to get a mammogram. We talk about colonoscopy. Question?
What's your opinion on the guidelines or whatever, not necessarily guidelines that come out, that just came out recently about you don't need to have the doctor do a breast exam on you in the clinic?
I think that I read a study where a yearly clinical breast exam and a mammogram are a little bit better at detecting abnormalities than a mammogram alone. A long time ago, they did come out and say, we shouldn't be teaching women self-breast exam. And that's because we are not very good at, as lay people, just saying, well, this is normal breast tissue. I ask women if they do a breast exam, and I ask if they have any concerns. Most of us have some fibrocystic changes in our breast. We have some lumps and bumps. Most of us are kind of symmetrical. One bump here, one bump here that matches. If you do a self-breast exam at home, I like for you to do it on a schedule so that you can look for changes yourself. If you do a self-breast exam once a year, I promise you'll find something concerning because you're just not familiar with this breast tissue. I still do a breast exam with a yearly exam. I have found a couple of things, even just this past month, that I think have merited further evaluation. And again, everything is always an option. So if you'd prefer not to have a breast exam, that's fine. If you'd prefer, yeah.
It's kind of ludicrous that they said you shouldn't ask for, or not ask, or get the yearly,
Yeah.
have your doctor do it. I just thought that was kind of crazy to me.
Yeah, I'm not sure. I didn't get that from the reading. I did get that they're no longer encouraging self-exams. And again, I just think many women do not do them often enough to not be alarmed with what they feel. If you do it once a year, you're like, ooh. Colonoscopy is another. I'm a big colonoscopy fan. First one at age 50. Yeah. I'll tell you why I'm a big colonoscopy fan. I've had 2 colonoscopies, and the prep is not particularly fun, but you are entirely empty at the end of that prep, entirely empty. And I feel like that's my true body weight. And I took 15 pounds off that, and that's what's on my driver's license. We also discussed bone density screening, and again, this is related to measuring your height. We all lose a little bit of height as our intervertebral discs get compressed. Gravity is not our friend for any reason. But a significant loss in height may be a change in your bone density. Periodically, I like to measure thyroid function. Thyroid disease is very common in women. Glucose level, especially if you have a family history of diabetes or if you had gestational diabetes in pregnancy. Vitamin D, we live in Minnesota where our days are short and we are bundled against the cold. Also periodically check fasting lipids. Vaccinations that we offer in our office include, they're not limited to, but they include the Tdap. Important for anyone who has a newborn at home or will be caring for a newborn. We have the flu shot every year, and we also offer the Gardasil vaccinations for young women 9 to 26. Number 6, these are some sobering statistics. But we also look for signs for domestic violence. Sometimes a doctor's visit may be the only time that a woman who is in an abusive relationship has an opportunity to be alone. Her husband or significant other or partner may accompany her to everything. And this is an opportunity where we say, oh no, this is a pelvic exam. You need to stay in the waiting room. And that may give her an opportunity to share her situation with us. In our bathrooms, we have a folded brochure from Safe Journey, which is a domestic violence organization. It's designed to fit in a jean pocket so that you don't leave the bathroom carrying anything. Again, and domestic violence, unfortunately, is not limited to women alone. The 37 Minnesotans who were killed in 2013, 24 of those were women, 13 were men. If you come to your annual and you are seeking a family medicine doc, a pediatrician, an internist, a dermatologist, or seeking genetic counseling because of a new diagnosis, I'm happy to provide that information for you. Most insurance plans don't require a written referral, but most people don't know, how do I begin? Where can I look for such a person? How can I find genetic counseling, for instance? So I'd be happy to hook you up with someone who can provide more information than I. The big one, number 4, talk about girl stuff. Your periods, whether or not you need pregnancy prevention, If you're trying to become pregnant, what should I be doing? How can I prepare for a healthy pregnancy? When is menopause? What is menopause like? What are the first signs of menopause? Here's a big one that many people are, actually a couple big ones, many people are embarrassed to talk about. Is sex painful? As we get older, we experience more vaginal dryness, have a little less elasticity to that tissue, and sex starts to hurt. We don't look forward to anything that hurts. And so it's kind of a vicious cycle. We have reduced desire because of anticipated pain. So please tell me if sex hurts, because I have lots of ways to fix that. Incontinence is another thing that we're kind of embarrassed to say. I laugh or sneeze and I leak urine. Again, very, very common as we get older, especially in women who have had pregnancies or vaginal deliveries. Who does this? If you're walking in the grocery store, oh wait, I gotta sneeze. So I recognize you, fellow stress incontinence patients. So, all right, number 3. We do perform a physical exam. And again, at your annual exam, I do a lot of things that are not just your PAP. Your PAP is only checking the health of your cervix. I look at your hair and nails. They give us a lot of information about nutrition. I listen to your heart. I listen to your lungs. Rarely, I will find a heart murmur that no one else has heard, and it may mean a change in your, in another health condition that has triggered that heart murmur. I feel for your thyroid. I look for lymph nodes. And most importantly, I do a skin exam in places that you can't see. In your packets, there is a brochure on the ABCDEs of melanoma. And it has a very nice illustration. How many people can look at the skin on their back? Not very many. How many people rely on a significant other to do so? How many people feel like maybe that person is not always, oh yeah, it looks the same. Maybe not super reliable. So an important part of a skin exam for me is I do look very carefully at the skin on your back. If there is a concerning mole, I may measure it. I may ask you to go home, send you home with a measuring tape and ask you to have someone take a picture of it. If you go to a dermatologist, you will get a very thorough skin exam, including looking through your hair. However, most commonly that person will say, does your gynecologist look at your bottom? And I do. So that's part of your initial pelvic exam, is looking at the vulva. Again, hard for you to see yourself, so I want you to know if there's a mole down there that I think should be watched or is concerning. And yes, the pelvic exam is still included in your annual exam. Again, I look for abnormalities on the vulva, whether it is a pigmented lesion or a red lesion or a white lesion. Also examine the vagina. Vulvar and vaginal cancers are very, very rare, but they are out there. It is a possibility. I check on the size and the shape of your uterus and ovaries, checking for masses, checking for fibroids. A physical exam is not the perfect exam of your internal organs, but if I find anything concerning, I will suggest that we get an ultrasound, which is going to give me measurements. And number 1, the top reason, and that is I deliver a lot of babies, and this is usually the last time that I really see them. They're wet and covered with cheese. So I am super happy if you come in and show me pictures of your children as they're growing. And sometimes I have delivered my patients' grandchildren. I'm happy to see those too. So that's all I have today. I just had a few minutes, so if you have any questions, I'd be happy to answer them. Oh, I forgot my show and tell. My goodness.
Do you want to show and tell?
Yes. So I am a sunscreen fan. My mother actually died of melanoma, 1962. So I am a sunscreen fiend. I have a basket to pass around. Most people, I hear a lot of people say, I don't wear sunscreen because I don't like it. It's greasy, or it's white, or I feel like I have to put too many products on my face. So I went to Target and I bought half a dozen sunscreens, SPF everything from 30 to 55. Anything over about 70, they're pulling your leg. So please, I'm just going to start this basket. If there's one that you find, you say, hey, I'd like to try that, please take a squirt and pass it on.
Any questions for Dr. Martini?
Thank you very much. Oh, question.
With the sunscreen, what is the lifespan on it too? Should you be doing that yearly, buying a new one?
It depends. I think the chemical sunscreens truly do have an expiration. The physical sunscreens, which include zinc oxide, it's a very inert substance. You could probably use it beyond its expiration date. On the box or on the tube or bottle itself, it will have an expiration date. So for the chemical ones, for sure.
I was just wondering, I heard that if you've had a hysterectomy, well, I had a partial one, that you don't need PAPs anymore?
It depends. So we can do a hysterectomy and leave the cervix behind. If you still have your cervix, you need a periodic PAP. If you had a hysterectomy for reasons that reasons other than a concern about your cervix, if you had a hysterectomy for bleeding or fibroids, you don't necessarily need a PAP anymore, but you still need a vaginal exam.
At what age do you recommend low density?
Some of it depends on your body frame and on your family history. The guidelines say 65. I will often do one sooner for women with a very small frame.
I just noticed on there when you were talking about the different immunizations, I didn't see anything to do with the pneumonia and the Prevnar and all of that.
And that's typically just because our office does not carry. I see Kristen's eyebrows going up. Oh, I'm sorry. We do not carry the pneumonia vaccine. We do not carry the shingles vaccination. But we can, yeah, we can talk about those. People ask me, when should I get those? Another question.
Are there alternatives to colonoscopy? Like, I heard something about some testing on the pieces.
Yes, there are alternatives to colonoscopy. Colonoscopy is the gold standard. It will find things before they begin to become fragile and bleed. A fecal testing card is looking typically for blood. Those are the most inexpensive ones. So there are alternatives, and I will suggest those for people that absolutely positively refuse a colonoscopy. But then I tell them about my weight story, and most people are super excited to have one. Question?
What is the Gardasil?
Gardasil is a vaccination for young girls, and it is against the HPV vaccine. Cervical cancer, 85% of cervical cancer is associated with two particular types of HPV. HPV is a very common virus. Most of us are exposed when we first become sexually active. And the idea behind the Gardasil vaccine is to provide an immunity to young women before they become sexually active. I hope they put me out of my job as far as doing procedures for abnormal PAPs. That would be awesome. Thank you very much. I hope you enjoyed the, another question.
One more question. I don't know, maybe you're out here. My husband passed away of colon cancer 9 years ago, and the colon doctor said that my kid should have a colonoscopy every 5 years. My daughter just had her second one, and she's 39, and they found a pre-cancer polyp. So thank you that she went in. But my son is 37, and he refuses to go in.
He can talk to my husband, who's 63 and refuses to go in. Yeah.
So, you know,
No.
he just says, yeah, just because you're a doctor, but the cancer doctor said it's so important because it is good, or it can be.
Colon cancer definitely can be, and with a first-degree relative, his father, screening at least 10 years before his dad's diagnosis, starting screening, and then every 5 years. If he refuses, again, there are alternatives, and I would encourage him to do something.
Yeah.
Oh. Another question?
She's raising it for me because I can't.
Oh, sorry.
I have a colonoscopy question as well. So, when you're in having a colonoscopy, are there differences, techniques of like the scope? It's sort of like with
Mhm.
Years ago, I had a colonoscopy, and apparently everything was so twisty, curvy. It was a huge ordeal. They couldn't get in. I had the whole barium tipped upside down, shaky radiation.
This sounds awful.
Are there different? It is. I'm supposed to have another one. So, are there different types of techniques once you're in for the colonoscopy that they can do to make it, or that I can request? I don't even know what to.
The only thing I could think of is they keep improving on the scopes. They become more and more flexible, so more and more able to get around those twists and turns. If at all possible, if you can go to the same place so that they have your record, or if you'd like to go to a different place, take your record so that your physician knows exactly kind of what happened, and express your concerns beforehand. I ask patients to do that all the time. If they've been ill with anesthesia or anything, say, tell us before so that we can, just be prepared. So, I'm sorry I can't answer your question fully, but I do have one of the GI docs here in the Twin City areas I went to medical school with, so I trust her training. I'd be happy to give you her name. Yeah, all right, again, thank you so much.